Oh, hey! So you caught me just as I'm doing a really good case that'll be relevant for you. So I've been talking a bit this month about how important sleep is and the major things that wind up impacting and affecting your sleep. So I just got through reviewing over a case where a patient came in who was having difficulty with sleep. She was having a hard time getting asleep and staying asleep, and it was causing her to be a bit grumpy throughout the day. She was starting to actually get some lower back pain and neck pain as well. So we went through and we did some imaging, we did some exams to try to understand what was going on to cause this problem. Then we also did some tests to see if we can wind up changing it. So I'm going to flip you around so you can join me on the screen, and then I'll look to mouse around and show you what I found. So we're going to flip around here and we're going to go right like this. Okay, so this was our patient, and when we got started, just so you know, some navigation here, the green lines are good, and you'll see the green lines right like that. That's ideally what the cervical curve or the curve in your neck should wind up looking like. The red lines, what I did was put on the back sides of each of the bones throughout this person's neck. Now, they should follow that green line. However, through life, trauma, injury, accidents, there can be shifts and changes to how those bones align, and typically it's due to ligament damage and change that doesn't really get rehabilitated or corrected. Now, as you can see, this goes the wrong way, and we wind up measuring it up here, and we should have a 42-degree angle. That's what it's average for all people. However, in this case, we have a 15-degree curve the wrong way. Now that puts a tremendous amount of stress on her neck and the spine, and it winds up reducing her ability to respond and adapt to the environment, causing her to have difficulties with sleep, energy levels, mood. She winds up having neck pain and lower back pain too. But that energy from her brain coming down her spine can't pour through to every tissue, organ, and gland in her body. What we did was some work to help reduce any inflammation that was going on. Then I wanted to see, can we shift or change this non-surgically? Because the way my surgeon colleagues determine if they've had a successful spinal fusion is if they've been able to restore the curve back to what should be that right position, or an 8-degree individual curve. Over here is where we tested that. So you might notice there's a device underneath this person's neck. This is a cervical dental, and if you want to check out one of our other videos about how important the cervical curve is and what we do with it, feel free to look for that in the links. And what we do is we have the person lie on this device, and we take an image to determine, can we improve the shape of this person's cervical curve and move it closer to normal and ideal. Now, obviously, when this person immediately comes out from underneath this device, they're going to go back to this configuration that they're in. However, there's been 7 dual control trials utilizing a tool just like this to show that over a period of time of use, we can actually wind up changing the cervical curve so that it looks more like this. We use this test to determine how much correction is available, because when people have had damage to their neck, unfortunately, and it's been left alone for a long time, they can't get back to ideal or normal. And you may notice, for this case, she can only get back to 23 degrees versus the 42 degrees. Now that's going to be a much more effective and efficient position for the energy to pour down her spine than this reverse curved. And I'm excited about her potential and her ability to wind up sleeping better, feeling better, and totally recuperating. Now, if you or someone you know has had problems with sleep position, and sleep posture, let's connect to find out, what does your cervical spine and curve look like, and what is the potential for correction that's still available. If you or someone you know is having problems with that, feel free to give me a call or email or post on here, and we'll look to find someone who's in your area that can wind up helping you to find out what's going on and to take care of the causes of the problems so that they don't knock you out. Once again, I'm Dr. Gregg Gerstin with Align Wellness Center in Northbrook, Illinois, and I want to thank you for letting me be a part of your health.